me introduce Kristen Stavenik and Asad Ghani. Did I get it right? Okay. And there's some handouts, I understand. Steve Stavro has some handouts, and the program is yours.
Good evening. My name is Asad Ghani, and this is my co-resident at Robertwood, Somerset, Kristen Stavenik. And we're both pharmacists there, pharmacy residents. And what we're talking about today is vitamins, minerals, and supplements. And what do you actually need to take? Go to this one. So I'm first introduce some vitamins and supplements and just give a general overview about them on the next slide. So it said that 74% of people that responded to this survey said they take supplements, and actually 92% said that it's essential to their well-being and their health. So it is supplements and minerals and vitamins are very commonly used. And some of the ones that are very important are calcium, potassium, and vitamin D. So calcium and vitamin D, we all know they're good for bone health. Calcium is also helpful in heart health and for your nerves. And you usually get these from yogurt, milk, but that's a commonly known thing, but you can also get them from spinach and other foods like tofu. And it's recommended that you get about 1,000 milligrams per day. So that's the recommended amount per day. And usually all these vitamins you get from your diet. For potassium, it's very important that it's a very important electrolyte that supports your heart, your muscles, your brain, and it's used widely throughout your body. And it's very important to get an adequate amount. However, in some people, you can go overboard of getting potassium, which can cause problems. So I'm not saying that everyone should take potassium supplements. I'm saying that especially if you have maybe kidney disease or anything, you should definitely contact your doctor before trying to start any of the supplements or minerals that we're going to talk about. Because it's really important since it affects not only how you might feel at the time, but it might affect the other medications that you're taking. So for vitamin D, again, bone health, very important. And basically it comes from many different places. Like I said, with the calcium, you can get it from other foods like yogurt, and it's recommended that you take 15 micrograms, or you can also see that it says 600 IU, which stands for international units. And the IUs are usually what's written on the bottles, like pharmacies or wherever you're buying. So more key nutrients, because you can't get enough. Fiber. Fiber is super important because it allows you to go regularly. And that's why, but it's very important that when you're having the fiber and you have a fibrous diet, you usually get it from vegetables, that you continue to drink water, because otherwise it can cause the opposite effect where you won't be able to go instead. And it's recommended that you have 30 grams per day of fiber. Again, usually that's just straight up through what you're eating. Folate, it's not only for women that are trying to become pregnant or are pregnant. It's not a supplement only for them. Everyone needs folate. So the reason why you need folate is because it protects your DNA, and it's used in DNA synthesis. So your genetic material requires folate. And it's recommended that you get 400 micrograms per day as well. And usually, again, most of these vitamins, nutrients that we're going to talk about, they're found mostly through your diet. And the only reason to be taking supplements is to supplement if your diet's not good enough. So let's talk about dietary supplements. And the first is a very important point that I want to make about dietary supplements on the next slide. Dietary supplements are not heavily controlled by the FDA. They're somewhat controlled. However, they do not do any efficacy testing, and they do not do any standardized testing to see what's in the product. So while a company may say it has X amount of this supplement in it, that's based only on their word. There's no governing body that actually looks into how much it actually has. And that'll come back up later on for melatonin that we're going to talk about later. And what's important is if you're buying or going to buy supplements, you should try to find the ones that have USP, the United States Pharmacopoeia stamp. That's basically a stamp of approval saying someone that's not the company has tested these products and has made sure that it says it has the actual amount it says on the bottle. And that though it's not an efficacy, like it won't tell you if it's actually helping or will affect what you're trying to treat, at least you'll know you're taking what you're taking and how much of it. So we broke down the next supplements basically on the reasons why you would be taking the supplements. So starting off first, digestion. Next slide. You can go to the next slide. So one important supplement for digestive health is Metamucil. Metamucil works by going into your gut and then absorbing the water that's in there and creating a more solid thing that could be pushed down through your system. Basically, what you have to do while taking this medication, the supplement, is that you have to take at least 1 glass of water, but I would recommend probably more than that. Because if you don't take enough water, it's not going to work. And like I said, with the fiber, it's going to do the exact opposite. It might actually cause more constipation and make everything worse. And you might get more abdominal cramps. So your stomach might hurt and you might get gas as well. And it's very important that you separate this at least 2 hours from any medication you're taking, because it might affect how that medication is absorbed in your system. So instead of being absorbed, it might just push it right through, which kind of makes the medication less effective. So the second digestive health supplement is Benefiber. Benefiber works in a similar way. It's said to improve gut health, and the important thing about this as well is that some of the side effects are pretty much the same, where you get the abdominal pain, some gas, some bloating. But this one you can actually use and cook with. I've never tried it. If anyone wants to try it, I'll take a piece of whatever you're making with the Benefiber. But I've never tried it. But it should not be mixed with anything carbonated. And the reason is because if you mix it with something carbonated, it's just gonna foam up everything. And then you get a flat drink, whatever you're drinking. So kind of useless on that one. And it's important for that, for Benefiber, if you are on a low sodium or a potassium diet, that you try to avoid this because it has sodium and potassium. The next category I'm going to talk about is brain function, because everyone wants to take a supplement to help their brain process more and be more alert. But do these supplements work? And I'll let you know. So Prevagen. Prevagen, the company has a big marketing department, and the studies that they haven't done, they say that it helps you with concentration and age-related memory loss. However, it's not actually been proven to do that. They claim it. However, it's not actually been proven. There's no efficacy study to show it because, again, they're supplements. Unlike medications and that you could buy at pharmacies where they, with the prescription, they actually test that rigorously to ensure that it does what it says it does. For supplements, the rules are a lot more relaxed. So their company is allowed to say something like it might help based on some studies that might be like 20 people large. So it's not a very good study. Nariva, very similar. It says that the company, again, claims 7 different things that could help you with alertness, reasoning, memory, focus, concentration, learning, and accuracy. Have they proven this through rigorous studies? No. They just claim it, again, based on some internal research that they did with small populations, meaning like 20 people, and they're like, oh yeah, I think I felt the difference. But that could be a placebo where it would be basically the same. Like they could have been given a sugar pill and then been like, yeah, I feel better. I feel more alert. And then basically that's what they get to claim. Next slide. Ginkgo biloba. So this supplement is said to actually have many different things that are very are across the spectrum. So it would be anxiety, allergies, dementia, eye problems, and peripheral artery disease. So if your circulation in your legs might not be the best, it's said to help that as well. And again, does it work? It doesn't have enough evidence to say that it does, so it's not really recommended to take, especially not since some of the side effects aren't the greatest. Like you might get a headache, stomach upset, dizziness, and you can actually, it might increase the bleeding risk as well. So people that have any diseases that might cause more bleeding or are taking any medications like aspirin, warfarin, enoxaparin, there's so many different, what other ones? Eliquis, Xarelto, all these things will increase your risk of bleeding. So these people should definitely avoid taking this medication, because why would you want to increase it for something that isn't shown to work? For Asian ginseng, very similar to ginkgo biloba, it has a couple different things that it's said to do, such as physical stamina, concentration, memory, and immune function. And there have been animal studies and some low quality human ones. So they might have not had, they definitely didn't have the rigor of a normal medication, which have shown that it might have some effect. However, again, this evidence is very minute and it's not very convincing. And again, for this this supplement, any person that's actually on blood thinners or NSAIDs like aspirin or ibuprofen, if you're taking those, you should definitely avoid this, especially since one of the side effects it can cause is blood pressure changes. So it might increase your blood pressure. So definitely avoid it as well if you have hypertension, because if you have hypertension or on medication and then you take this, then your medication kind of goes by the wayside, kind of wasteful. And now we're going to talk about more multivitamins.
Okay, so for multivitamins, you can change the slide. So pretty much for multivitamins, like Asad mentioned, you want to take them to supplement an already healthy diet. So making sure that you're getting your nutrients mainly from your food, because food is the best source of nutrients. But these are good to take to supplement a healthy diet. And on the next few slides, I'll talk a little bit more about it. So you can switch the slide, please. Okay, so vitamins for your health. These vitamins that you're seeing, vitamin A, D, E, and K, those vitamins are fat soluble, which means that they absorb in your body in your fat. So if you're taking too much of them, it's hard for your body to let go of those extra nutrients. So those are the ones you need to watch out for if you're taking too much in your supplement. Some water-soluble vitamins, ones that leave your body quickly because they pretty much leave your system throughout the day, is vitamins B and C. So those are less concerning to kind of overdo it on. But especially vitamin K, if you're taking blood thinners, you need to watch out that you shouldn't take more than you need, particularly with warfarin. Next slide, please. Okay, so what's unique about men's 50+ vitamins? I know that there's an example is 1 a day men's 50+ vitamin. The difference really is that they provide more vitamin B and trace elements, which are typically metals. We need certain metals just as to function as human beings. Things like iron, even copper. Those are examples of trace elements. So these men's vitamins 50 plus, they provide more vitamin B and more calcium and vitamin D and less iron than for the regular formulation of one a day, just as an example. Okay, so here we'll talk about cholesterol lowering supplements. The first supplement that we'll talk about is niacin, also known as vitamin B3. And just as a disclaimer, the American Heart Association does not really recommend its use in cholesterol lowering. Right now, they don't recommend it, but it can lower cholesterol and triglycerides. The low dose will cause some flushing and redness, and the high dose will sometimes lower your high cholesterol, but it is prescription. So you'd have to get a prescription. Okay, you can change the slide. Okay, here we'll talk about omega-3 fatty acids, which is also known as fish oil. So fish oil is used for lowering high cholesterol at low doses, and it is effective. But it can cause more bleeding if you take it in combination with your blood thinner, let's say like Eliquis or Xarelto or warfarin as an example. Even antidepressants, those can cause a risk of bleeding when you take it in combination with fish oils. But they are useful as a supplement, but just keep in mind that they can cause bad taste in the mouth sometimes. Some people have like this repeating effect, bad breath, and even heartburn, which I guess it just goes as a blanket statement that all of these supplements do have their side effects. So just keep that in mind and talk to your doctor if you want to start one of them. Okay, so for bone and joint health, we mentioned vitamin D and calcium are great for bone health, but next we'll talk about what's good for bone and joint health. So glucosamine and chondroitin, it's a supplement that can be helpful for arthritis. And the glucosamine and chondroitin are the structural components of cartilage, which is the tissue that cushions the joints. And it isn't helpful so much in certain cases, and it's unclear. The evidence is unclear that it is helpful, but some people do find a benefit. This might cause bloating, nausea, diarrhea, and constipation, and might worsen asthma. So do keep that in mind. And if you're allergic to shellfish or take warfarin, again, try to avoid this supplement. Okay, moving on to sleep. Okay, so melatonin. Melatonin can be useful for a lot of people. It's used for jet lag, delayed sleep phase, or like when you want to change your sleep schedule, like let's say you're working night shift and you want to sleep during the day, that can be helpful. And it can be helpful if you're having any anxiety over sleeping. One thing to note is that if you want to take this, but you're having trouble waking up a lot during the night, this one isn't really going to help so much. It really helps you just to fall asleep, but it won't help with middle of the night when you wake up. If you do want to take it, just keep in mind that higher doses might cause nightmares. It's recommended to start out low, maybe like 1 milligram if you're thinking of taking this. Some other things that people take for sleep might be Benadryl. That's not the best recommendation. The best thing you can do to fall asleep is to try to keep good sleep hygiene, which means that you want to keep your room at night cooler, on the cooler end. Yeah, you want to reduce daytime napping. Try to do relaxing activities before bed, nothing crazy. No crazy TV shows before bed, that kind of thing. That's really the best thing, keeping a good sleep schedule. Those are really going to be more helpful than supplements that you take. But this is an option. You can change the slide, please. Okay, so for eyesight, we're going to talk on the next slide on lutein and zeaxanthin. So these are used for protection in eye diseases, including cataracts and vision loss related to like macular degeneration and blue light exposure. It's possibly effective for vision loss related to age and cataracts. In higher doses, there may be more side effects, but it is generally safe. This should be taken, the typical dose is 10 to 20 milligram, and for zeaxanthin, it's 2 milligram. But like I said, if you are thinking of starting this, just make sure to talk to your doctor. Okay, supplements to boost your immune system. So starting off with probiotics. Probiotics, there is some evidence that they might be helpful for things like diarrhea and antibiotic-associated diarrhea. Really, the best thing you can do is to eat your yogurt that has lots of probiotics, even things like pickled and fermented foods, pickles, that kind of thing actually can build up the good bacteria in your gut and might be better than taking these probiotics, and especially because they are expensive. People that should avoid it are those that are seriously ill or people who have a weakened immune system. So if you're on any medication that does weaken your immune system, you should avoid taking this because it has the potential to actually cause infection. Okay, so vitamin C. Vitamin C can help protect you from air pollution, UV damage, and also maintain health, immune systems. People who take it regularly might have slightly shorter colds or milder symptoms. But at high doses, this can cause diarrhea, nausea, and stomach cramps. And there is a concern for the safety of taking this if you get a lot of kidney stones. Also, if you have cancer or if you are taking medications that lower your immune system, this should be avoided. And a lot of times you might see this over the counter or in the store at high doses. Just try to avoid anything over 2,000 milligrams because that is the maximum dose you should be taking in a day. Otherwise, you might get, like I said, diarrhea or nausea or stomach cramps. Okay, so zinc. Zinc may strengthen your immune system. It's helpful in wound healing and can help with the common cold. It is shown to be in studies possibly effective in shortening the common cold, but there's more studies are needed to determine if this is truly effective and how long it should be taken. If you do take it at high doses, it can cause dizziness, headache, and loss of appetite. And if you have like kidney disease and you're taking zinc, just be careful because the level of zinc can build up in your blood if you have renal disease. But you should keep in mind that a lot of people get enough zinc from the food they eat.
Alrighty. Now I'm gonna talk about prostate health with our friend on the next slide, zinc. So does zinc help with any urinary prostate health or anything of that sort? No. I mean, there's minimal evidence that it shows that actually works or not. And again, some of the side effects of zinc aren't the greatest, like the stomach upset, and it can also cause dysgeusia, which is a fancy term meaning altered taste. And if you have altered taste, I personally like to taste food. I don't know if anyone wants to take a good amount of zinc and not be able to taste food, but yeah, so that's one of the side effects, and it's not really proven that it actually helps with any urinary symptoms or any prostate effects. And again, like Kristen said, if you have renal dysfunction, so any kidney problems, it's probably best that you don't take supplements for zinc because it can accumulate and cause more problems. So saw palmetto, this is probably the one that is the best, but still doesn't have the greatest evidence for prostate health. So out of the three supplements I'll be talking about for prostate health, this one probably has the best evidence, but even then it wasn't really shown to be very beneficial in any of the urinary symptoms. So if you have prostate problems, and however, it is usually well tolerated. Some of the side effects could be some digestive symptoms. So again, upset stomach, possibly diarrhea, or you might get a headache. Excellent. Vitamin E. Should vitamin E be used for prostate health? No, because it actually can increase the risk of prostate cancer. This doesn't mean you avoid vitamin E. It just means you shouldn't try to supplement yourself with vitamin E because it could possibly increase the risk. There was just something that one of the studies saw that there was a higher risk. So it's not to say that you can't take vitamin E at all, but just again, before starting it, have a conversation with your doctor together. And some of the side effects of this is again, an increased risk of bleeding. And again, some of these bleeds can be very serious, like it can happen in your brain, which is a very serious incident. Okay. And usually, again, vitamin E, most people get an adequate amount through the diet alone, so you don't really need to supplement it. Supplements are to supplement if you don't have a good enough diet.
Okay, so next we'll talk about pain and some supplements that can help with pain. The first one that we have here is coenzyme Q10, or it's also known as CoQ10. And this is used for muscle pain that results from cholesterol-lowering medications called statins. It's possibly effective for muscle pain in people that have muscle pain that are taking statins, but it's not useful for other claims like cancer prevention, heart disease, or high blood pressure or Parkinson's. It can cause you to stay up at night, have a stomach upset or a headache, and people that should avoid it are those that are taking warfarin or even insulin. It should be avoided. So for hair growth, so the first thing I'll talk about is minoxidil, which is also known by the brand name of Rogaine. It's a topical medication that helps hair regrowth due to hair loss. It's not used for frontal baldness or receding hairlines, but it does work. It's effective and it is FDA approved. And the hair growth should be evident within 4 to 6 months of use. It's pretty safe. Just keep it away from the eyes, the nose, and the mouth. It might result in some itchiness of the scalp, so just be aware. But you should talk to your doctor before you start it and make sure that they are okay with you starting it as well.
One of the other main points of minoxidil is if you do start it, you may have to continue it because any of the hair growth that you do gain that while taking it might go away when you stop. So it's like if you don't use it, you lose it type of situation. Yeah, that.
Yeah, and there's a little bit of hair loss as well, just starting out with it. But your doctor will explain a lot of dermatologists are very good at the hair loss as well. But you might notice there's some initial hair loss when you just first start using it. So biotin. Biotin is used for male pattern baldness caused by biotin deficiency, and it's also useful for skin and health. So does it work? There is some evidence for its effectiveness in biotin deficiency if you're someone that has that deficiency. But if there is no biotin deficiency, there's no connection between more hair regrowth and taking the supplement. So it's safe if you consume it within the daily intake, but you shouldn't take it if you have lab tests that measure thyroid function. It can actually interfere with these tests and cause a false result for any thyroid function tests. And if you are using testosterone, don't take this one either. So if you do have a biotin deficiency, you can take this as you need, 30 to 100 microgram per day. So just to conclude, we do have a flyer that was passed out for us. It has some helpful resources for you on the National Institute on Aging. It's got the QR code, so hopefully you might have used them before. You just kind of snap a photo and the link should pop up to the link on the internet to these resources for you. But I wanted to thank you so much for having us. We're excited to be here. And we're going to open the floor for questions. Yes. The Balance of Nature products. Are you familiar?
I'm a little bit familiar. I'm not too familiar with them. Is there a specific question about them? Oh, yeah.
I'll do some research for you. I didn't, I've never seen the commercial, but I'll do some research and I will get back to you. If not this evening, then I'll go ahead and email out so you can have the answer. Yes, gentleman in the back. Yeah, so vitamin C and kidney stones. So vitamin C can cause kidney stones if you are someone that does get kidney stones a lot, it's like someone that's prone to getting kidney stones. You shouldn't probably supplement with too much vitamin C because it is in our diets. It's in things like oranges and lots of fruits. So you should avoid supplementing if you do get kidney stones because it can cause you to get more kidney stones. How much does effect of water have on kidney stones?
I'm not entirely. Oops, sorry. I'm not entirely sure if there's a relationship between water and kidney stones. That's definitely something that we could look up and let you know about from just, yeah, so that's definitely something we'll look up and let you know more about, or rather not say something incorrect. Yeah.
What are the dangers and side effects of using Tylenol PM to go to sleep?
Yeah.
Yeah, so Tylenol PM, so that has acetaminophen for pain, the Tylenol part, and then the PM part is usually Benadryl. So I usually recommend if you're using it for sleep, if you have pain and are trying to go to sleep, sometimes just just the Tylenol will be helpful, rather than combining those two together. But you can use it if you would like, but I generally recommend trying to see if just the plain Tylenol helps if you're having trouble sleeping due to pain. If you're having trouble sleeping for other reasons, like you're nervous for presentation the next day, let's say, Benadryl, you can use it from time to time. I would say try not to use it every night, just because it's not very good to keep using Benadryl every day. It's going to be less effective over time. So that same goes for the Tylenol PM. The Benadryl component in the Tylenol PM might become less effective over time. You build a tolerance to it. So sometimes it's just better to use something, if you wanted to use something, maybe the melatonin, start off at a low dose, like the 1 milligram. Try to see if there's the USP stamp that we talked about earlier in the presentation. That might be helpful, as well as, like I mentioned, the sleep hygiene tips. That would be.
I heard that folic acid is very good to take. What's your recommendation on that? Folic acid?
Yeah.
So, so again, like I said, you can definitely take it. It's a supplement. Usually, again, with all these things, you can definitely take folic acid by itself as a supplement. However, usually most individuals' diets include enough folic acid, so it usually doesn't have to be supplemented. If there's a specific reason, again, that you think folic acid will help you, you can definitely contact your doctor and let them know, and then they could maybe talk to you more about if there's other options as well.
Vitamin D and calcium, as you
Yeah.
probably both know, there's a lot of stuff online questioning the efficacy of both of those, especially for people that either work in the sun or have great dietary regimes. But my question is, because they're always talked about in tandem, are they mutually exclusive or do they work together? And specifically for calcium, I've read a lot that too much calcium can have negative coronary markers. So could you comment on both those subjects?
Okay. So for vitamin D and calcium, the reason why they're usually paired together is because they work in a tandem, where vitamin D allows you to absorb more calcium, and it also has a couple more functions on your bones as well in the way that it uses the calcium. So that's why usually they're together. And again, for most people, and especially if you have a good diet and you wouldn't need to supplement with the vitamin D, but some people do have osteoporosis, and in that condition, you would need to get usually a doctor prescribes a vitamin D supplement, not a supplement, but like actual medication, which has like a strong dose of vitamin D that would help you with the bones. And for the excessive calcium intake and affecting coronaries, I'm not fully sure about the relationship. So again, I rather get back to you on that. That's definitely something I'll jot down right now and look into so I can answer you.
How would anybody know if they?
Mhm.
How do the proton pump inhibitors such as Prilosec or the H2 blockers such as Pepsid affect vitamins and minerals, especially for people that are anemic, taking B12, iron, folic acid.
Can I get this one? I got this one. I do know the answer. Okay, so for these acid reducers, basically both of them, if you have reduced acid in your stomach, it'll decrease the amount of B12 that you absorb. Because the way B12 is absorbed into your body requires that acid to be there. That way, if you don't have that acid, it just won't be absorbed as well. And that also goes into if you have a disease or had surgery in your stomach and which is causing less acid to be formed, you might get B12 deficiency. And at that point, a doctor would let you know that you should be taking, that you'll have to get possibly B12 injections because your stomach is just not able, it's not possible to absorb the B12 that you need. So also for iron, you also need it to have some acidity to be absorbed. So again, if you're taking these proton pump inhibitors or these H2 blockers, Pepsid, if you're taking these medications, then the amount that you absorb will be decreased. So it won't work as well.
Another question, on the omega-3s, you indicated 1 a day. Doesn't that depend on the dosage of the omega?
Could you,
Studies that I read, they recommend 1 gram twice a day, 2,000 milligrams a day,
for which
omega-3s.
omega-3s?
Stump.
If you could answer that one, I got it.
Yeah, so for the omega-3s, typically if you want the higher dose, it's usually for like heart benefits, and normally those are prescription omega-3 fish oils. So they will provide the higher dose, and they are beneficial for cardiac issues. So, and also high cholesterol they use it for.
I have a question about the cannabis, the liquids that you can buy in the little bottles, you put 2 drops under your tongue before you go to sleep. I don't use it, but my significant other uses it practically all the time, and can you get addicted to that, and what is the effect of that on other things that you might be taking, other vitamins and minerals, other pills that you might be taking if you regularly use those cannabis drops, 2 or 3 drops under the tongue before you go to sleep.
Yeah, so for the cannabis drops, it might be possibly effective for different things like sleep. It is possibly effective in pain, but yeah. For the drop ones, I'm not exactly sure if it's like from a gas station, let's say. I would try to avoid those just because we don't know how much of the product is actually in them. It could be less, it could be more, the dose might vary, but it is possibly effective. I'm not quite sure. Do you know the any interactions?
Yeah.
Yeah, it's expensive.
Warfarin, right? No. So for the interactions, there are some potential interactions. I know for one interaction, like off the top of my head, is with a blood thinner, warfarin, also known as Coumadin. It does have an interaction in between where it could increase, again, your risk of bleeding. So depending what you're taking, it may be effective, but maybe possibly the risks outweigh the benefits. So again, that's definitely something that you should talk to your doctor about, so they know exactly what you're taking, so they could adjust as they can. That way they might be able to figure out some other thing that might help you with the sleep and the pain, or maybe they'll switch something else.
Hey, let me comment a little bit about cannabis since I worked in the addiction field many years ago. Is because it still remains as illegal from a federal point of view, they don't fund any research or haven't historically funded research using the THC, understanding the THC impacts on interactions with vitamins or interactions with other drugs. Even though many people have been asking to do this research and wanting to do the research, there isn't a lot of data. And that's kind of the problem that's out there. Everything that's going to happen in the future is going to be all anecdotal based on everybody now using in various, states that it's legal, like New Jersey, and to see what happens and who gets sick, who doesn't, or what goes on.
Let's go ahead.
Okay, what is the best time of day to take a multivitamin if you're taking, medications? Is there a good time or a bad time?
It depends on the medication. I think generally if you want to separate it, just to be on the safe side by about 4 hours from your medication, that would be a good rule of thumb. But it does depend on which medication prescription you might be taking. I can't think of off the top of my head which ones, but there are certain medications that should be separated. Maybe like this Benefiber, that's something that you would want to separate from your medications, and probably multivitamin as well.
I have a couple of questions. Potency after the expiration date. People tend to hang on to drugs for periods of time after the expiration date. Can you comment on the potency?
Yeah. So medications are tested for their expiration date with kind of like an accelerated testing method. They expose them to humidity and all types of elements and then see what happens to their potency. So the date on the bottle, I would probably stick with that. Don't try to take things that are very expired because they could be more potent or less potent. We just don't know. So just use caution if you're doing that.
Especially with antibiotics like tetracyclines, so tetracycline, doxycycline, those are definitely medications you don't want to take after because it could cause kidney problems, like serious kidney problems. So those definitely don't take after they say they're expired. When they're expired, you should probably get rid of them.
I have another question. Analgesics or pain meds. And if you covered this during your presentation, I apologize, but some are processed through the stomach and some through the liver. Do you have any comment about which ones are processed and which ones are recommended? Acetaminophen versus ibuprofen, that kind of stuff.
That one would be more based on the person to person and what type of pain you're having. Because while Tylenol, so acetaminophen is metabolized by your liver, so it goes through your liver. If your liver is not great, then it's not the one that you should be taking. And at the same time, Advil and ibuprofen or naproxen, that gets metabolized by your kidneys, so it goes through your kidneys instead. And it also causes water retention, which may cause water and sodium retention, which can cause higher blood pressure. So if you have high blood pressure and continue taking those, your blood pressure is going to be higher. So again, it really depends person to person. And if you ever needed a suggestion, again, I know I'm harping on the fact that contact your doctor, but it's really important. That's the way to keep everyone safe and just make sure everything goes well.
I appreciate your comment about contacting the doctor. My experience is that I go to the doctor and they say, what medications are you taking, including over-the-counter meds? And I give them the list and that's the end of it. I don't get any feedback about, possible drug interactions with prescription drugs. So you have any recommendations as a consumer where we can go to to get more educated? I mean, your presentation has been very helpful. But, you know, we're all going home and we're all gonna take drugs, so, or supplements. So, any comment?
So for that one, I would recommend, I mean, I know they're not, sometimes doctors may not be looking at the medical, what do you call it, the which medications you're taking. You could definitely mention, I'm concerned about this, and hopefully they'll understand that. As well as you can possibly go to your local pharmacist where you fill up those medications and let them know. And just, you could set up an appointment with them usually where they'll go over what medications you're taking, because that's what we do. We look at the medications, we see what you're taking and try to see if there's any drug interactions or anything that you should be careful of.
Yeah, and also on the handouts that we gave, there is a link to 2 different websites that might be helpful for you all, just for information purposes on more information on supplements.
Could I ask one more question? Sorry. On balance, do you recommend multivitamins, either the ones 50 plus or the regular ones, or are they just a complete waste of time?
You can use them to supplement a healthy diet. And if you wanted to take them, you could do the 50 plus or just the regular one is fine too. The 50 plus, I think I mentioned, it has more vitamin B and calcium just for bone health, and also vitamin B for more energy. That's really, I think, the key difference. Yeah, and there's lower iron in the men's 50 plus vitamins.
So
just
on
in-
balance, you feel they are beneficial?
I think they can be, yeah.
Thank you.
Any more questions? Okay, I want to thank both Kristen